What did I ask you? One of the things that you're aware of too, and I'm aware of, it's rare, but it still happens, is something called eosinophilic esophagitis, where going through the desensitization or eating the peanuts, they develop that eosinophilic sort of allergic inflammation, which is not good. I mean, they could get, tightness in their esophagus. Have you seen that, and do you think going at this lower dose, you'll be able to avoid that? Did you see any cases of that in the study?
So in our lower dose, I didn't see that. We didn't find patients that developed EOE, but we had a relatively lower sample size, like around 17 kids between 15 and 17. So we need larger studies to assess that, because the incidence of EOE or eosinophilic esophagitis in patients that go through desensitization is about only 5% and less. Now, it's very interesting with EOE because it's not IgE-mediated process, unlike the life-threatening food allergy. And this has evolved as well, because I had parents whose child developed EOE. I had a few mainly with milk. And the parent told me, I don't care about the EOE. I know it's problem swallowing. I know about the scar that might develop in the future, but I'm more afraid that my child will die after having accidental exposure to
Right.
milk.
So that's where the risk benefit has to
Exactly,
come into
yeah.
play.
So now it's a
Sure.
shared decision. So in the past, we would stop and things will resolve.
Yeah.
Now, rather than stop, we discuss it with parents, and sometimes we say, okay, let's give them a little bit of proton pump inhibitors like Prevacid and reduce the dose and see what's happening with the EOE. And if the parent is very committed,